Hi, my name is Jen Lowe, and I am a counselor in the state of Michigan and North Carolina. I work with women, children, and teenagers with emetophobia. I'm in my PhD program at the University of the Cumberlands, and I'm currently writing my dissertation on the topic of emetophobia. And I just finished chapter 2, which is the literature review, where we review all of the peer-reviewed, there's a lot, the peer-reviewed journal articles about our topic and write chapter 2. And as I was going through this, I thought there's some really good information that we don't talk about and people should know about. But some of these research articles, you have to have a library subscription or you have to pay to view them. So here is some of the literature. Fear. A fear is defined as a basic, intense emotion aroused by the detection of imminent threat. It involves an immediate alarm reaction, mobilizes the organism through psychological and physiological changes. Physical changes associated with fear, rapid heartbeat, redirection of blood from the gut. That's going to come into play later. Muscle tension. Fear is a short-term response triggered by a present identifiable threat. Emetophobia is an intense fear of vomiting. The fear may, and I tried on a lot of these slides to put may or to bold the word may, because as we know, with any sort of mental health situation, that it affects everyone differently. So some people with emetophobia fear vomiting themselves, seeing others vomit, or sort of the social anxiety aspect of vomiting in front of other people in public. Emetophobia is actually not in our DSM-5 TR. If someone came to therapy for emetophobia, they would be diagnosed instead with a specific phobia. Specific phobia characteristics: persistent and irrational fear, immediate anxiety response. The fear is out of proportion to actual danger. Active avoidance or endurance with distress causes significant functional impairment. With folks with specific phobia, they can have panic attacks. Two types of panic attacks occur: cued and uncued. Cued panic attacks are triggered by specific stimuli, such as seeing vomit. Uncued panic attacks appear unexpected. Physical symptoms are the same regardless of the type. Panic contributes to the development and maintenance of the phobia. Cognitive factors. Cognitions maintain the fear once the phobia develops. Cognitions are another word for thoughts. Catastrophic thoughts are common. Examples: I might go crazy. I will lose control. I can't handle this. Fear extends beyond vomiting itself to a fear of having a panic attack. So sometimes when people come to therapy, they're not just scared that they're going to see vomit. They're scared that they're going to see vomit and then have a panic attack or not be able to handle it. Catastrophic interpretations reinforce the anxiety. Interoceptive sensitivity. So this was something that was interesting in the research. Individuals with emetophobia show a heightened sensitivity to bodily sensations. I wish the word may was there. There may be constant monitoring of nausea and gastrointestinal sensations. Prevalence, onset, and duration. Prevalence in women ranges from 6 to 7%. Women represent approximately 80 to 90% of the cases. So as therapists that treat emetophobia, most of our clients are females. Typical onset occurs between 8 and 12. There was another study where they interviewed people and 9 seemed to be the average. The condition is often chronic. The average duration is 25 years. Over half of people with emetophobia in surveys report that in that 25 years, there was no periods of remission, and many report only brief or partial remission. Comorbidity. Comorbidity is a weird word in mental health and it refers to the presence of two or more disorders. Common comorbid conditions include depression, generalized anxiety disorder, panic disorder, social anxiety disorder, OCD, and hypochondrias, which we call health anxiety nowadays. Diagnostic overlap increases the complexity. However, in one of the surveys, when they interviewed people with emetophobia, 41% reported having no additional condition. Common fears. Fears of vomiting oneself, seeing others vomit, or vomiting in the presence of others. Associated fears include contamination, shame, social judgment, and loss of control. Vomiting in public is often associated with anticipated negative evaluation, so other people think bad things about me or think I'm gross, and embarrassment. Vomiting cues activate worst case imagery and distressing memories, reinforcing the fear. Fear-related caregiving difficulties may evoke shame, guilt, and perceived failure. Avoidance. So, a lot of the literature interviewed, surveyed people with emetophobia about what are some of the things that they avoid. And if we think about what we previously covered, this is a severe phobia, affects 25 years of a person's life sometimes, can cause panic attacks. So it's natural for us to sort of want to avoid things that would cause us distress, right? Not that that's always helpful, but these are some of the things that people will avoid. Avoidance of expired or unsafe foods and avoidance of eating outside the home, avoidance of travel, restaurants, and social gatherings, avoidance of public transportation, buses and airplanes, avoidance of alcohol-related settings, places where children play, and foreign countries, avoidance of medications, pregnancy, anesthesia, or surgery. Avoidance behaviors may result in dietary restrictions or significant impairment. That last one we have to be careful of. Sometimes when people are restricting food, we may automatically think it's an eating disorder, and that may not always be the case. Safety-seeking behaviors, repeated checking of expiration dates and food freshness, frequent monitoring of bodily symptoms and reassurance seeking, overcooking food and frequent temperature checking, excessive hand washing and cleaning behaviors, carrying items such as antacids, crackers, or soda to prevent nausea or to help with nausea. Nausea is a central mechanism. Nausea occurs more frequently and intensely in individuals with emetophobia, particularly during anxiety episodes. Nausea is often misattributed to physical illness rather than anxiety. Normal or ambiguous sensations are catastrophically misinterpreted as precursors to vomit. Fear intensifies nausea, which reinforces fear and perpetuates the cycle. So even though these are things that are published in peer-reviewed journal articles, I do wish I had written may on all of these because everyone is different. Everyone experiences different symptoms. So someone may have one of these and not the other, or all of them. So yeah, something to keep in mind. Humans are complex. Disgust sensitivity. Disgust sensitivity refers to the negative evaluation of disgust experiences, distinct from disgust propensity. Individuals with emetophobia demonstrate significantly higher disgust sensitivity and propensity. Disgust sensitivity is the strongest predictor of emetophobia symptoms. Disgust-based emotional reasoning leads to overestimation of threat in safe situations. Disgust is a primary driver of risk overestimation. Elevated disgust sensitivity predicts avoidance of related stimuli. That last one, right? If someone thinks something is disgusting, and it's really, 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 really gross, and they're very sensitive to it, it makes sense that they would want to avoid it or their brain would want to avoid it. Emotional regulation. This was interesting. One of the recent studies um, just looked into how do people with emetophobia, how does emotional regulation come into play? So, emotional regulation refers to the ability to adjust thoughts, focus, emotions, and behaviors. Individuals with emetophobia may struggle to regulate emotions when exposed to vomiting related stimuli. Difficulty regulating emotions contributes to avoidance and distancing strategies. I love this. I love this for any type of mental health provider that is helping people with emetophobia in that whatever branch of treatment you're doing or engaging in, perhaps we should work more on emotional regulation skills and helping people with emetophobia sort of regulate those emotions when they're exposed to these stimuli. Internal locus of control. This article I found interesting. I feel as though this was not something that were in the emetophobia books, the treatment manuals, um, the trainings that I had gone to. Locus of control refers to perceived control over life events. So we have an internal locus of control and an external locus of control. So a lot of times with anxiety, people are anxious about things that are outside of their control, an external locus of control. There could be a bad driver on the highway and they could hit me. There could be a lot of traffic. There could be a lot of construction. A deer could run out in front of me. Those are things that I can't control. That's called external locus of control. Um, Individuals with emetophobia demonstrate significantly higher internal locus of control over life and health related events. Vomiting represents a loss of control, right? Can't control it. Something happens to us sometimes. Fear of losing control is proposed as a maintaining mechanism that why do I have a stomach ache? I should be able to control this. I can't throw up. I've even met people who do not want to feel like they should be able to, oh, my stomach is hurting. They should be able to control their bodily sensations when bodies just do weird stuff sometimes. All right. Intrusive imagery. Approximately 80% of individuals with specific phobia of vomiting report intrusive imagery. 81% report multi-sensory intrusive imagery. Reported imagery includes adult memories, child memories, and imagined worst case scenarios. Imagery is frequently triggered by nausea, stomach sensations, or seeing unwell individuals. Intrusive imagery plays a central role in the maintenance of the phobia. Okay. The second one, 81% report multisensory. We need to talk about what that is. They're not just experiencing a picture in their mind or a little video of a vomiting experience. They're also experiencing the smell and the sound, or if it's themselves, the taste. Um, so, yeah, it's not just a picture of something gross popping into their head. They're really experiencing that through a multi-sensory approach. Again, I think this helps if we know this in the treatment of it. So if there is a lady with emetophobia who's talking about an experience they had when they were 18 on an airplane, asking them not just what they saw, but what smells they experienced or physical sensations, asking them about that. And then if that person experiences something that triggers or makes them anxious, oh, Jen, on the way to your office when I was driving, there was a car that pulled to the side of the road and I was worried that that person was sick. And then I had a memory from childhood come to my mind. Instead of me just having them tell me about what came to their mind, I also want to know, did it make you feel gross? Did you remember the smell? Did you remember the sound? What else sort of came to your mind besides that picture from childhood? Okay. Oh, that comes into play with this one. Autobiographical memories. Individuals with specific phobia of vomiting recall earlier vomiting related autobiographical memories and rate them as more distressing than controls. We'll talk about what that means. People with emetophobia remember things from childhood that other people do not. I went to a public school, kindergarten through fifth grade. Well, elementary school. I also went middle school, high school. Let's talk about elementary school. I couldn't tell you. If you asked me some memories of someone getting sick at school, I don't think I have any. Perhaps I remember a janitor being called because I remember they had like a box of stuff they could sprinkle to help absorb it, to help them clean it up better. Um, but I can't remember who or when. But my clients with emetophobia, they can tell me memories from childhood in detail. Before onset, memories of others vomiting are recalled. After onset, fewer memories of self-vomiting and more of others vomiting are recalled. It's hard to understand. Um, so if someone says, "Oh, Jen, I think I've had this phobia since age 9," um, before age 9, they have memories of other people. After age 9, they really kind of tell you more of themselves, um, but they are focusing on others. But again, everyone is different. Everyone has different memories. So I don't really know. Um, and again, that might just be one survey or one study, but everyone's different. But that is interesting, like to think about with people with this phobia. Do you remember more memories before you were diagnosed or after you think you have this phobia? And is it of other people or yourself? Something to explore, right? Memories are linked to interpersonal events, health consequences, and emotionally significant life experiences. This is very interesting. So when someone shares a memory from when they were 13, they will not just share that memory of that person being sick, but they'll say, "Oh, that was the week my parents told us they were getting a divorce. That was the week we all had chicken pox." So there are other things connected to that memory. Okay. Vomiting cues reactivate autobiographical memories and worst case imagery, reinforcing the fears. So, again, driving to your office, Jen, saw someone on the side of the road. It wasn't just that they saw someone on the side of the road, it also brought up those other things. Intrusive images may function as flashbacks or flash forwards. All right. In my chapter 2, I also went into the different treatments for emetophobia, but I didn't want to make a really super long video. Or 19 minutes, long enough.